After completing this lesson, you'll be able to name 3 characteristics of late preterm newborns which affect their capacity to breastfeed effectively. Let's begin by defining the late preterm baby. These babies are born between 34 plus 0 gestation and 36 plus 6. So, in this study here, which was published in 2020, it says comprising nearly 75% of babies born less than 37 weeks of gestation. Late preterm infants are at increased risk for morbidities involving nearly every organ system, as well as higher risk of mortality when compared to term neonates. Neurodevelopmental impairment has especially been a concern for these infants. Due to various reasons, the rate of late preterm births continue to rise worldwide. Caring for this high-risk population contributes a significant financial burden to health systems. These are babies who require rapid brain growth after birth because they've missed out on the intrauterine brain growth during those last few weeks of development. We need to have a system and a plan where we optimize nutrition and environment around this need for neurodevelopmental progress. Emphasizing brain growth and development when we speak to parents, these are strong motivators for them to optimize the earliest care of their babies and the environment they set up for their babies to grow in. One way to think about what makes the late preterm baby different from a healthy term baby is that they aren't beginning at the same starting line. So you may see on the floor of your hospital, in one room, there's a baby who's born at 39 weeks, a healthy term baby. Next door to a baby who was born at 36 weeks, a healthy late preterm baby. And I say healthy to indicate they didn't have any problems with breathing or other distress that caused them to be admitted to the hospital's NICU, right? You've got a baby who most of their organ systems are potentially underdeveloped, but they are still okay enough to be in the room with their mother or in a nursery which provides less intensive care. So these babies are not at the same starting line as the healthy term baby. And it's like they have to catch up to where healthy term babies start. And that usually happens around their original due date. So what this actually ends up looking like is that these babies are going to have 2, 3, 4, 5 weeks of developing and breastfeeding during this time where it's going to be harder for them. Now, when they approach their original due date, what we typically see is that they begin to act and feed like healthy term babies, but they could be 2, 3, 4, 5, 6 weeks old at that point. We need to start from the beginning with helping parents to understand the additional needs that late preterm babies have. And one of the things that's going on for them in terms of these underdeveloped organ systems, the neural control of breathing and respiratory rhythm happens in the brainstem. So their immaturity impacts their cycle of arousal, sleeping and waking, and coordination of feeding and breathing. This is a brainstem maturation issue. We talked about that previously. When something is tied to how the brainstem matures, we can't speed it up by any external measures. We simply have to wait for that maturation to happen. Late preterm babies also have a neurologically underdeveloped gut. So their organ systems are all working to get to the point of maturity and begin to develop normally. So during this time, we want to optimize everything that's happening for them in terms of what they're eating, how they're eating, and how they're being cared for around feeding. When we're working with a baby who is late preterm, it's important for us to adopt this mindset and keep in mind always that being born late preterm or early term, which would be a baby that's between 37 plus 0 and 38 plus 6, That is the issue that is driving breastfeeding problems. They could also be latching poorly. There could be low milk production. There could be low birth weight. There could be tongue tie or any other problem that's impacting the lactation situation. However, the overriding problem is that the baby was born late preterm or early term. So they have an issue with maturity that needs time to develop. So set the scene here. Think about how people tend to act and immediately understand the urgency, the stress, the burden of giving birth to a baby who is born at 32 weeks. Everyone knows this baby's going to stay in the hospital for some time. It's going to be difficult for the parents. This baby may have some special, additional medical or health needs as they begin to grow and throughout their lifespan. When a baby's born at 35 weeks, there's no such fanfare. It's really not looked at the same way. Even though a baby born at 35 weeks may also need to stay in the hospital or not, may also have other health conditions or not, but specifically will very likely have feeding issues that are going to be stressful and cause burden to the parents. So what happens is if the baby is otherwise healthy, parents take home a late preterm baby who has vulnerabilities that other people can't see. It's not obvious to them. It doesn't always even make sense to other people. The family themselves may also have been talked out of worrying about it. For instance, if something is going on with the mother's health in the pregnancy and it's determined that the best option is to induce labor and birth early, the way that that's talked about may have made the parents feel like because that was the priority, it's not going to cause an impact, the fact that the baby's being born early. Well, it still is, unfortunately. So simply because it had to be done doesn't mean that it's not going to have an impact. Just as we talked about when it comes to birth interventions, just because they're considered relatively safe doesn't mean they don't have impacts. So we need to be really clear with parents about what it means for a baby to be born in the late preterm period. And we're going to focus on the late preterm period, even though some of the things that we talk about here will also apply to the early term baby. So again, the late preterm baby born between 34 and 36 plus 6. This is a very specific time span where we know what's happening with neurological development, the baby's brain development, and what they need when they're born at this time. When we talk about the growth and development that are happening for babies before they're born, the last few weeks of being in utero are typically characterized by the baby accumulating weight on their body and differentiating the structures in the brain. So that's what the baby has missed out on. But that's just two pieces of what the baby missed out on. So managing infant feeding and lactation for the late preterm baby is going to require additional tasks, mental work, emotional burden. And parents really deserve to have the information they need to put context around why they have to do those extra things so that it doesn't bury them. When they understand what it's for, why it's happening, then it makes a lot more sense and it can be more manageable for them. So for instance, if we are teaching them about how to use a breast pump in the hospital, we must always be sure to include information that helps them to understand that the fact that they're using a pump now doesn't mean that their baby will never latch or cannot breastfeed. It simply means that they need to do this now. This is expected to be a limited situation because of the baby's prematurity. If we don't say that, they may think that their baby simply can't latch because they were born early. If we teach them that they are pumping in addition to latching, in addition to putting the baby skin to skin, allowing the baby to nuzzle and attempt to breastfeed whenever they want, and all the other things they're doing, then they can feel like they have this larger proactive plan around feeding. Like, they didn't change their goals. It's not that they're not going to breastfeed. It's simply that they have to do these extra things temporarily until their baby catches up to where they need to be in order for them to meet their own breastfeeding goals. So let's look at this study from 2022, a literature search of 9 articles. They were all looking at interventions that were attempted as a way to increase any breastfeeding or exclusive breastfeeding or breast milk yield with late preterm babies. The conclusion was professional support significantly improved exclusive breastfeeding rates. So professional support matters, makes a difference, definitely shown an impact, professional support on breastfeeding. This study from 2020 looked again at late preterm babies specifically and said they are at increased risk of various morbidities and mortality, including respiratory distress and respiratory failure, feeding difficulties, poor growth, hypoglycemia, hyperbilirubinemia, and hypothermia. These morbidities not only cause prolonged hospital stay after birth, but also increase the risk for readmission following hospital discharge. Suboptimal neurodevelopment outcomes in late preterm infants are a cause for concern, indicating the sequelae of earlier insults to the developing brain. Going back to what we talked about with the brain and the arousal system, this is part of why late preterm babies have an increased risk for readmission, having to do with a parent life-threatening event, which is often described as it seemed like the baby wasn't breathing, or perhaps the baby wasn't actually breathing once they've gone home, readmission for infections. These are huge risks. Readmitting a baby to the hospital means that there is a big risk, a big vulnerability. So we need to be clear with parents from the beginning about the additional burden of vulnerability that their baby has, even though it seems on the surface like they were just born a little bit early and a little bit small. You can't see the vulnerabilities that they have as easily as you can with a preterm baby. So this can sometimes be misleading. And especially when it comes to feeding, this is very misleading and hard for people to automatically, immediately understand. In this study from 2020, this was a Japanese nationwide birth cohort study. So this is a study of more than 31,000 people. Late preterm infants had a higher risk of all-cause hospitalizations, but the rehospitalization of late preterm infants for gastrointestinal infections was lower in exclusively human milk fed babies. Feeding only human milk made a significant difference in how often they were rehospitalized for gastrointestinal infections. So, since we can't go back in time and change the way or the time that a baby was born, what we can do is promote exclusive human milk feeding to optimize outcomes and mitigate some of these existing risks and challenges. The study from 2018 was looking at breastfeeding self-efficacy in the mothers of late preterm infants. Essentially, what we already know about breastfeeding self-efficacy in all mothers holds true with the mothers of late preterm babies as well. When they were able to exclusively breastfeed their babies, they had higher breastfeeding self-efficacy scores. And for late preterm babies, their scores were higher if they were exclusively breastfeeding when their late preterm baby reached their due date and when their baby was 3 months of age. So we need to use the tools that we have to increase breastfeeding self-efficacy from pregnancy on, especially when we're looking at late preterm birth. Understanding what is going on for the late preterm baby, these parents are going to need specific guidance to help them contextualize that their babies are not just like healthy term newborns, so that they can act on this information as well as communicate it to the other people in their lives. They think that what's happening with their baby is just like what happened to all their friends and their neighbors and their coworkers, but they actually have a different situation and a very different opportunity. So, one critical difference for them is when you think about the context of parents looking into other ways to care for their baby, sleep training programs, unresponsive parenting behaviors like not responding to the baby at night, or not feeding responsively. These are not at all congruent with what late preterm babies actually need neurodevelopmentally. So these parents are going to be making different decisions sometimes because of their baby's vulnerabilities, even things that they didn't think they would do before. Their plans and intentions around how they're going to feed their baby, they can change drastically when the baby is born, even just a few weeks early. And what we need to do is give them the information and guidance that helps them to decide whether or not they will go back to what they originally thought they were going to do, or they're going to pursue different types of feeding and care because of what they know about their baby's vulnerabilities.